Hey, Dr. Lindsey and Wendy here. We're going to tell you this is another young guy video that all you younger guys, that means 25 or younger, need to watch this. And you ought to watch this with your parents. And we got plenty of these young guy videos. And the whole goal is to keep you from making the stupid mistake. Meaning, don't do it before you need to. Don't get a goofy low hairline that's not going to age well with you. And make sure you put enough hairs per square inch, even if it means you can't cover everything. You just got to avoid those mistakes and look at a bunch of our videos and do your research. So this kid he was 23 when he came in.
He already has
he's
a
bald.
lot of hair loss. Yeah.
And he's doing a kind of a wispy comb over, but he's bald and he's a nice boy. He just graduated from college and he runs a supermarket, deli or something. Mm-hmm. And he's a good boy. He came in with his parents and essentially we give him my hairline. So here he is at the day of the surgery, and he's packed in there really well. He doesn't have an unlimited donor supply. I think we did like 2,400 on him.
Yeah, he has wispy hair.
And he needs 7,000, but we got 2,400 I think on him. And he was a good boy and came I think 3 or 4 times that week and cleaned.
Yeah, he did a good job cleaning.
And here he is at a week, and then at a month, and then he rolled in last week at 6 months. And so 6 months is a tough time, you get it today, and it all falls out a month from today, and then the few stragglers that you got in the recipient area start growing back about 2 months from today, and the customer thinks that that's when the real hair is growing, but it's not. It takes about 5 to 8 months before it starts growing. So here he is at 6 months, and it's probably half grown, and he looks pretty good.
He's happy.
Yeah.
Yes.
So he did a little video. So take a look at this. All right, Steve. I know your name's Sam. All right, Steve. It's 6 months, right? Since we did this?
6 months, yeah.
And how old are you? I can't remember.
I'm 24.
Bend over one time. So we did the fronts, and you probably remember how many grafts. I haven't looked at your chart yet. How many grafts did we put in your head?
2,400,
okay.
23.
And turn around and face the blue wall one time. And we got more work to do at some point. Look up at the ceiling, if you would. So you can see where we stopped, and we do kind of a little curve across here, so that in case you don't ever show back up, it doesn't look like a straight line. Lean forward a little bit, if you would. And let me show the scar. It's a pretty typical Lindsey scar. Right there it is. Is your numbness all gone?
At this point, yeah.
And was that pretty upfront with you? Anything?
No, without
surprises? Okay.
No, no surprises.
All right, man. We'll see it in another 6 or 7 months. So I think we're right on track with him, Wendy. It's growing for him. He's less uptight that he's balding. I mean, he's still got pretty thin hair, and it'll look better. And he's going to need a second case.
He will definitely. And for him, this even though we can only give him what he thin hair because that's what he has, and he understood all that. He followed the instructions to a T. Yeah. He's been really compliant. I mean, he comes when the 6 months. That's when we ask him to come. That way we can remind him that it's not done yet, because then you feel like you waited so long, and it's like that's all I got. So it just to remind our patients that it's just starting.
Yep. And so I know he'll be back at about 12 months for a follow-up video, and probably to plan a second case, in which we'll start right behind where we stop this time, and put a few hundred hairs along the hairline. And I think he'll turn out great.
Yeah, I think so. Yeah.
So you younger guys, don't make stupid mistakes. Do your research. Involve your parents. Whether you like your parents or not, they'll help you avoid making a silly mistake just for the sake of saving a few pennies or doing something that your friends tell you to do. And if we can help you, please give us a call. Thanks.